It really is food for thought. It's really a perspective to consider. I'm bringing you a perspective from the work that I've been doing at the Mental Health Foundation in the UK over the last 5 years, especially drawing on that perspective. And, you know, it will resonate with some of you and it won't resonate with others, and that's absolutely fine. So for those of you who aren't familiar with the Mental Health Foundation, just to say hello from the Mental Health Foundation. It's one of the oldest mental health charities in the UK. It's over 70 years old. Our vision is good mental health for all. We have a strong ethos of redressing mental health inequalities in our work. And we do focus on prevention, and mostly in that on primary prevention. And we're the home of Mental Health Awareness Week, which takes place in the UK, usually in the second week of May. We have offices in London, Glasgow, Belfast, and Cardiff, so we really are rare among mental health charities in being genuinely UK-wide. And I know that my colleague in our Belfast office would be only too happy, our head of Belfast, Karen Hall, to say hello to any of you who want to take the Enterprise train up for the day and come back. It's an hourly service now, so do feel free. We think, why focus on prevention? Well, I mean, I'm here with an audience of people who know how important mental health is, but our own research, which LSE carried out for us, found that conservatively mental health problems cost the UK economy 118 billion pounds per annum. And so it is one of the biggest social challenges of our generation. The other reason that we focus on prevention is that we now have good evidence that we can reduce mental health problems and prevent mental health problems arising, you know, in terms of the level of prevalence in the population. And in that same report that the London School of Economics did for us, they provided an overview of the cost-effective interventions that prevent mental health problems. And there are interventions across the life course. So we know cost-effective interventions exist that support parents, you know, and parenting programs, and those are very cost-effective. We know that there are workplace interventions that are effective, particularly rapid access to psychosocial, psychological support from the workplace. And so there are a range of interventions, and the evidence base is growing every single day. And we also think it's really important that at the same time that we're trying to reduce the overall level of mental distress and the overall level of mental health disorders in our society, that we must reduce mental health inequalities as well. And I'm going to talk about that much more as we go along. This is the Mental Health Foundation's, what I would call our recipe for achievement in better population mental health. And we started in our own work. We have one strand of activity that is about influencing public policy. Having a public policy environment that supports investment in mental health, that supports having a good mental health, an adequate mental health workforce. And then you do need effective prevention programs in communities and for communities and individuals. And we in the foundation do much of our work is on designing and piloting innovative models of programs, and particularly in recent years on programs that build the capacity of frontline organizations working in communities to better provide preventative mental health support. And then you do need to of course, have a strand of activity, of effort that is around empowering individuals and educating individuals so that they can, for themselves, take the best possible action to support their own mental health and prevent mental distress. So you need those three elements. And we think if you work effectively across all three of those elements, you will end up reducing the burden of mental health as a phenomenon on society and on health systems and social care systems, and you will end up with a more, dare I say, a happier, a better functioning, a more cohesive economy and society. So I'm going to spend the rest of my time today talking to you about a public mental health approach. And I didn't put it on this slide, but I did put on purpose in the title of the talk in the program, Public Mental Health Approach, ? Okay, because I recognize this is kind of a different way of thinking than I think usually gets discussed in the kind of suicide prevention realm. And so I'm putting it out here as a possibility, particularly at this time where Ireland is reviewing its suicide prevention strategy, that there's an opportunity maybe to bring this lens, this perspective in to to a greater extent in our next efforts on suicide prevention. So this is actually Wikimedia's image on Bronfenbrenner's ecological model. So thank you to Wikimedia, and I have made a donation, and I invite you all to make a donation to Wikipedia. The starting point for a public mental health approach is that people don't exist in isolation. None of us develops or experiences life entirely in isolation, and our outcomes are not a result of only things that have to do with us as individuals. So that is a starting point of a public mental health approach. The outcomes for us as individuals are influenced by the circumstances in which we are born, grow, live, work, and die. So all of that is partly the basis for the outcomes that we are going to achieve in life and the kind of life and how we're going to be able to cope with life. And we've heard a bit about that already this morning. You know, people talking about trauma, for example. And trauma doesn't come from nowhere. You know, trauma is often arises from people's social circumstances. We know, for example, that adverse childhood experiences happen more. There's a greater risk of having an adverse childhood experience if you are living in socioeconomic disadvantage. And that people living in poverty are much more likely to have experiences of adverse experiences in childhood and adulthood. So people's mental health outcomes don't occur in a vacuum. So if we're thinking about this, what then are the influences on people's likelihood of developing a mental health problem? And here we talk about the social determinants of mental health, which are widely recognized in mental health policy. I think, see them discussed much less in suicide prevention policy, and I think that's something to look at. But here we're focusing on the social, economic, cultural, environmental, and commercial circumstances of health. We're talking about trying to address the causes of the causes, as it's sometimes referred to. So there's the proximate cause, the immediate cause of someone engaging in suicidal or self-harm behavior, but what are the causes of the causes? And we can think about that in terms of, for example, alcohol and drug misuse, which we're seeing as now a greater risk factor for suicidal behavior and self-harm behavior. But what is the causes then of alcoholism and substance misuse? And oftentimes we can look at people's social circumstances and see that. In this paper that I was involved in writing back in 2020 called Tackling Social Inequalities to Reduce Mental Health Problems, we looked at trying to describe the overview of the social determinants of mental health, and we did a kind of categorization. I mean, there's a lot of different ways of slicing this pie, but we start here with economic influences and under that category is included education, educational attainment, working life, workplace terms and conditions. I was looking it up this morning and realizing that Ireland is really ahead of the game in terms of, for example, protecting people from 0 hours contracts. So one's working life circumstances and socioeconomic position as well in terms of social class, but really as well actual financial status. And here we would include debt status as well. We know that having particularly short-term debt puts your mental health at risk. We have relational influences as one category that's here. And in that, we're talking both about the interpersonal relationships in the family, experience of domestic sexual violence or abuse, but also we're talking about relationships in society, bullying that's experienced. We know that's a very well-established risk factor for poor mental health, but also racism and prejudice and discrimination based on any social identity or status, gender, sexual orientation, gender identity, disability status, all of that risk of and experiences of prejudice and discrimination are also influences on whether someone will develop a mental health problem or not. We have included a category of health, disability, and aging. And of course, we know that people with long-term health conditions are at greater risk of having a mental health problem as well. And apologies, I'm using the language of mental health problem because that's the language that tends to be used in the UK, but I know, I hope you'll forgive me that if that's not a language that you're comfortable with. So, we know that our physical health affects our mental health. But we also, again, like in terms of someone living with a disability, that if they don't receive reasonable accommodation, if they can't access the kinds of activities that support their mental health, that support social connectedness, that allow them to have employment and all of that, then their mental health will be at risk. And indeed, similarly for aging, where you might experience greater impairment over time, physical impairment over time, but also loss of social roles, loss of bereavement, and greater social isolation, all can put mental health at risk as we age. And then there are sort of social determinants from our environment, just having a safe home, having a home that's free of damp, that you can afford to heat, living in a safe neighborhood. We talk in Mental Health Foundation about the ways of supporting mental health, and we talk about encouraging people to get exercise and go for a walk, but we also recognize not everyone else has this personal safety in their neighborhood to be able to go for a walk. Similarly, do we all have access to nature, which we know is protective of mental health? not necessarily, depending on where you live. And we also highlight transport, and particularly affordable, accessible transport is very important for supporting people to maintain social connectedness. One of the pieces of research I don't actually talk about it later on here, but one that we just recently completed was with asylum seekers in Scotland, asking them about the significance of not having access to free transport, to public transport, and that effects on their mental health. And that report has been influential to some extent. There's a whole campaign in Scotland, in the Scottish government yesterday, announcing they're refunding their free transport scheme for asylum seekers. So, so something like free transport, which years ago I would have thought, oh, transport, we don't need to involve them, in a mental health conversation. And I have come to understand that absolutely they need to be part of a mental health conversation. So I've been talking about the social determinants in general, but what if we considered suicide prevention from a social determinants perspective? What kinds of social determinants might we consider? And I had a look at Connecting for Life, and I started looking at, okay, what are the risk factors that are identified in Connecting for Life? And I think that we can relate in Ireland in suicide prevention. We can actually identify some social determinants that are related to suicide risk. And I start with social isolation, which is identified in Connecting for Life. And we know in Ireland that we have very relatively high rates of loneliness. Over 20% of respondents in Ireland reported feeling lonely. And this was reported in the Irish Independent of a EU-wide study, highest levels of loneliness in Europe. So loneliness is something that is, we would consider a social determinant. It's a societal problem, and something that we might be able to take action on. Connecting for Life identifies job loss as a risk factor. My reading of Connecting for Life, it kind of positions it as an individual risk factor, but I would like to see it more identified as a social issue. Many times, job loss arises from some shift in society that's taking place that is affecting an industry. We know the NRSF itself did research about the recession and found the connection between recession and an increased risk of suicide. I'm going to cite a statistic here. The Irish probable suicide death study, looking at data from 2015 to 2018, found that a quarter of those who took their own life were unemployed. And this is much higher than the unemployment rate for the population as a whole. And we can think of industries and sectors of the workforce in Ireland that may be vulnerable over coming years to job loss. I was talking to Ray, we were talking about this, and I hope people don't mind, but I always come back to the example of taxi regulation in Ireland and the enormous distress that caused to some taxi drivers who had invested heavily in a taxi license which overnight became much less valuable. So what if there had been a suicide prevention approach to that regulation process? Would there still maybe be, some people here, who aren't here today because we didn't look at that process in terms of suicide prevention? And if we're thinking about climate action, it was mentioned earlier about the farming community, and the biggest stressor they identified was government policies on climate action. So, and I couldn't find, again, I may be out of out of the loop, but I couldn't find a just transition for climate action policy in Ireland. We need that as a suicide prevention measure. We need a just transition policy, and we need to make sure that the development of that just transition on climate action is part of Ireland's next suicide prevention strategy. We can also think about poverty. The Samaritans did a piece of analysis showing the links between socioeconomic disadvantage and suicidal behavior, and showing that people who had an income loss that led to them having suddenly less consumption power than they had had prior to that income loss, that was a group that was vulnerable to suicidal behavior and to suicide. And so that recognition that poverty, I mean, we know that poverty is probably one of the widest, most fundamental drivers of poor mental health at a population level. And we still have, like, we think of Ireland as such a wealthy country right now. I mean, particularly me, I see the difference because I go back and forth between the UK and Ireland once a month. And in the UK, all the conversations are about financial stress and not having enough money, you know, to provide public services. And we are in such a fortunate position in Ireland, and yet, shockingly, 13% of the Irish population are living in poverty. That is really shocking. So it is an issue for us here, and we need to recognize that. I can obviously reference age and youth, and we know that young people are very high-risk groups, so I won't even say any more about that. But also, you know, it has been recognized about middle-aged men being a high-risk group for suicide as well. What is it about the circumstances that middle-aged men are experiencing in their lives? What is it about what society does to middle-aged men in terms of their careers, their working lives, that gives rise to that greatest risk? And again, I would refer to the farming research in that regard. If you've worked as a farmer for 20 years, 30 years in a certain regulatory environment, and then that regulatory environment changes, is that going to be really challenging to cope with? Racism and immigration status. And we need to consider conversations about race and ethnicity in Ireland, both in terms of its, you know, the positive effects that good, inclusive language and messaging can have for people's mental health, but also that experiences of racism put people's mental health at risk. And are known to be a very significant stressor on people's mental health. And my old colleague Rebecca Murphy did some very good work on this in terms of highlighting that African asylum seekers in Ireland, that there are some people who are reporting that their experience waiting in the asylum system has led to them certainly making efforts to take their own life. So there are lots of good reasons to fix the asylum system, and this is yet another good reason to fix the asylum system. And then finally, just to highlight domestic and sexual violence and abuse. This is research from Wales. A review of deaths in domestic settings or following domestic abuse in England and Wales found that a quarter of these deaths were suspected victim suicides. So that's an area that has a very particular history in Ireland, domestic and sexual violence and abuse. I think it needs to feature more in our thinking around suicide prevention. And I could go on and on, which very glad to tell you, I'm not going to go on and on, but there are a lot of social determinants of mental health. That shouldn't stop us. Don't feel overwhelmed by that. You know, you can pick out particular ones that you want to focus on in a strategy at a certain point in time, given the particular environment that's going on in Ireland, and that's totally fine. The other thing about a public mental health approach is it looks at the social determinants, those influences, but it also has a strong ethos of redressing mental health inequalities. We know that mental health problems are more common the further down the social ladder you are. And a public mental health approach seeks to reduce inequalities not only from socioeconomic circumstances, but also from identities such as race and ethnicity, gender identity, sexual orientation, and disability. It seeks to achieve health equity, that is, that everyone can achieve their full potential for health and well-being, health equity. In the last few minutes, I just will flag for you some recent research that I've been involved in through the Mental Health Foundation. I'm only just listing and referring to these, and I'm happy to tell you how to find them. You can hunt them down on our website. We've done some work. We did a systematic review on universal basic income that found the connections between unconditional income supports and improvements in mental well-being. We did research on 0 hours contracts and found both, of course, the association between 0 hours contracts and worse mental health outcomes, poor mental well-being, but also that association disappeared in countries like Australia, where you get 25% more in your pay packet if you work on a 0 hours contract. Very interesting. We did a huge study. Over 17,000 students were involved in the Thriving Learners studies, 2 studies, one in universities and one in further education. And in terms of considering the social determinants, we found a clear association between food insecurity among students and low mental well-being and depression. A quarter of the students who were experiencing food insecurity had severe symptoms of depression. So that's something that we don't often talk about. When we talk about student mental health, we talk about the stresses and strains of education and all of that. What about the fact that the students are struggling to actually get enough food to eat? We did groundbreaking research on poverty stigma, and again found a link between both received unfair treatment based on one's low income status and symptoms of anxiety and depression, and also on perceived structural stigma, that is, those who saw that they perceived that society treats people on low incomes less fairly, they had worse mental health outcomes. And finally, one last to flag for you is a new piece of research just carried out for us by Leeds University. This is modeling research using the UK's Understanding Society, a longitudinal study in which we found that providing an income support for parents who are on universal credit, which is a low-income benefit, improved the scores on the mental component score, so improved mental health well-being, and we extrapolate from that it would improve their children's mental health and well-being as well. So some different approaches to mental health research focusing on the social determinants. What am I saying? Let's look upstream, right? Doesn't mean we have to abandon the downstream, but let's also try incorporating an upstream focus in our suicide prevention efforts. Let's look at public policies that could foster better resilience and prevent suicide. Here's some potential. I wanted to just tell you that we can see this as an example in case you're curious. We can see an example of this kind of thinking in the draft suicide and self-harm strategy in Wales, which was published earlier this year, and the full strategy is expected in the new year, where they say that suicide and self-harm are public health issues, but they are also inequality issues linked to social determinants of health such as socioeconomic disadvantage and adverse childhood experiences. It is for this reason that suicide prevention does not belong to any one sector and instead requires a cross-sectoral and a cross-government approach. So what kinds of interventions? Well, this is really blue sky thinking, so forgive me, but don't we need a loneliness strategy in Ireland? We have no loneliness strategy in this country. We need a just transition policy on climate change. How about a job guarantee? We had a job guarantee for young people during the recession. I can't find it anymore. And we never had a job guarantee for middle-aged people. But it seems like they need a job guarantee too. And what about a minimum income guarantee? Already, the basic income pilot for artists in Ireland is showing positive results on mental health outcomes. Maybe that needs to be part of our suicide prevention strategy as well. So I'll just leave you with this image, which my ex-colleague Antonis Kousoulis and his colleague at the time, Isabella Goldie, produced. This is just a picture that shows to you that in order to achieve good mental health for all, we need the circumstances in which we are born, live, grow, work, and age to be positive and promoting of those good mental health outcomes. Thank you.